Well, a medical panel appointed by U.S. Health Secretary Robert F. Kennedy Jr. held its first meeting on Wednesday, pledging to revisit the childhood vaccine schedule and promoting themes long embraced by the anti-vaccine activists. The Advisory Committee on Immunization Practices, an independent group that reviews scientific evidence to determine who should receive vaccines and when, rarely draws headlines. Well, the panel's first major test comes on Thursday when it votes on whether to recommend a newly approved antibody shot against RSV or respiratory syncytial virus for infants whose mothers did not receive an RSV vaccine during pregnancy. And for more on this, we have Amit Mukherjee joining us. Well, Amit, how will the overall of ACIP panel, including the appointment of the members with such known vaccine skepticism, affect the credibility and effectiveness of the vaccine policy making in the US especially?
Well, Lipakshi, we must understand at this point in time that, the Trump administration is going for the overhaul of the entire, medical program, which is administered to the citizens of the health program, which is administered to the citizens of the United States. Now, one of the most critical things is the immunization program, which Kennedy Jr.'s team is now looking at. This group is of the view that most of the immunization that is happening in the US right now are uncalled for. In fact, the ACIP has created two teams right now, which will be looking at two very, very critical elements as far as the immunization program of US is concerned. Number one, vaccines like those respiratory as well as the COVID-19 vaccines, which are being administered currently to the US citizens. What is the efficacy of those vaccines? What is the fallout on adolescents as well as children who are administered these vaccines? Number two, that this panel will also take a look at whether the mandatory HIV vaccine, the hepatitis B vaccine, which is administered to all infants before leaving the hospital, whether it's required or not. Because the ACIP panel is of the opinion that most developed countries do not administer as many vaccines which US health services offer to the infants in their country. So those things are being taken care of, and also the ACIP panel will also review the vaccines which are being administered but have not been reviewed for the last 7 years.
Absolutely. Absolutely. Thank you so much for all those details.